Hi, it's Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska. I'm just doing a short video about phlebotomy. A lot of patients kind of wonder what's the process when somebody comes in to do a blood draw, and why would it perhaps be slightly different from one person next? Well, first let's just talk about a little bit about phlebotomy in itself, taking blood and having it tested. Why would you want that done? There's all kinds of different conditions and disorders and deficiencies and hormones that can be tested through the blood. It's a great, fairly non-invasive way of figuring out what's going on, whether that's in your intestines or whether that's going on in an inflammatory condition with rheumatoid arthritis, or whether that's going on with your blood sugar. Truly, if you're not testing, you're guessing. So there's lots of good reasons for doing a good blood test. So the process, though, normally it starts with a fast. In our office, so if you're a patient of ours or considering to be a patient of ours, we almost always recommend that you come fasting. Fasting means you're not eating, and usually for about 12 hours prior to doing that particular blood draw. Generally that means if you're coming in at 8 o'clock in the morning, well, you shouldn't be eating after 8 o'clock the previous evening, right? So that's a fast. Some tests don't really need a fast. So if all you're doing is just testing for thyroid, for instance, that's not fasting. But when in doubt, fast. Next thing to kind of consider is when you're coming in is make sure that you are plenty hydrated. Some people come in and they are dehydrated. And so when I say fasting, it means don't eat or drink anything with any kind of caloric value to it. You can drink water. Please do. Drink a normal amount of water before you come in. Normal might be a little different from one person to the next, but still, we want to make sure that people are plenty hydrated when they come in. Don't drink any sodas. Don't drink any coffee with creamer in it. Just water before you come in. That will help to hydrate the veins and allow the blood draw to go more smoothly. Another thing, when people come in, we try to use the largest needle that is normal for phlebotomy. Normally it's a 21 gauge needle. People ask, well, why can't you use a smaller needle? And we often do, by the way, because if it's a smaller vein, we use a smaller needle. Some people, you can't get blood out of the median cubital vein or the basilic or the cephalic vein. You have to go somewhere else. You have to maybe go in the wrist or the hand, and so you have to use a smaller vein. But the one reason for using a normal needle, gauge needle, a 21 or 22 gauge needle, is because if you use smaller and smaller needles, the blood draw takes longer. If the blood draw takes longer, you might have a condition in the blood that's created called hemolysis, where the red blood cells are being destroyed, and that could alter some of the test. So still, a 21 gauge needle is very small, it's very non-invasive. We certainly take our time. We do not do a bunch of digging when we do blood draws. We want to make sure that this is an easy enough process for everybody involved, and it almost always is. I've had probably literally hundreds of blood draws on myself during training, and also just for blood draws in general. It's a very easy process. And we also use a tourniquet, right? So you use a tourniquet, kind of a rubber band over the arm. A lot of people ask, well, why is that? Well, remember that the blood that we're getting out of the vein is coming from the hand up back to the lungs to get reoxygenated. So if you put a tourniquet on here, it creates a little bit of a barrier, and so it creates more venous pressure down distal or into the arm. So it allows the vein to kind of bulge up a little bit. It allows the blood draw to go a little bit more easily, so that we can get blood out in a more timely manner. We use also sometimes a variety of different tubes. Some tubes you use for some vacutainers, you'll use for testing for thyroid. Maybe there's other whole blood tubes that have an actual chemical in them, that clot inhibitors, that keeps the blood from clotting. There's a lot of specialty tubes that are sometimes used for maybe heavy metals, and even testing certain types of infectious organisms, such as TB, etc. So when it tends to be a more specialized test, we have to make sure that we have certain tubes available. Turnaround time on labs, that can be usually within a day to 2 days. because we do send our labs out to a certified lab. We're not actually testing the majority of the blood here in our office. We're sending that out to a certified lab, Quest, LabCorp, several other, Vibrant America. We have lots of different accounts. And we can also order labs in other states as well, which is convenient for our patients as well. Let's see, what else I want to talk about there. Also, yeah, you need to make sure when you're coming in for your blood draw, make sure you do tell, whether you're here or somewhere else, tell whoever is drawing your blood if you have an allergy to latex or an allergy to some Band-Aids, for instance, sometimes will irritate some people, and latex gloves will. So make sure you talk to the phlebotomist or whoever's drawing your blood so that you don't have some type of an allergic reaction to what they're using on you with gloves or with a Band-Aid. You can also use Coban, which is a type of wrapping that also helps to hold the cotton ball on so that it prevents bleeding afterwards. A lot of patients afterwards, within an hour, 2 hours, they take off the Band-Aid with the cotton ball right over where the blood was drawn out of, and they're done. Some people might have a small amount of bruising or a little bit of discomfort, and usually applying a little bit of ice to that area will help with any kind of amount of inflammation that might be present there as well. So I think that's all we're going to talk about here today. I just want to give you a little bit of a brief summary of what we do here with phlebotomy in our office. Lots of great things about it. Like I always say, is that not to test as guess, but to test is to know. But we always want to make it a comfortable process for all of our patients. So try to do one thing today to make yourself healthier than you were the day before, and do one thing tomorrow, and the next day, and the next day, and the next day, and you will be surprised what your body is able to do. Murray Natural Integrated Health, setting the standard in natural health care.